insight into what is happening, what is really happening in our world of health. Remember, there has been an issues with maternal mortality, and indeed, the outgoing health minister, Ms. Shelley Arite, has been speaking much about it. She is very worried about the maternal mortality rate in Ghana, most especially when it comes to our part of the country, that is Volta region. So I have two gentlemen in the studios here with me. They will be giving us an insight as to what is really happening in Volta region with regards maternal mortality. I have Mr. Fred Avornyo as well as Eddie Ameh in the studios here at Bimbla. They are from Penplusbytes. Before we go into the interview itself, I would like to know from Mr. Fred Avornyo what really Penplusbytes means.
So we are ICT buyers, and we are into the training of journalists, and we cover various aspects when it comes to the training. We do the extractive, as in mining, oil and gas. We do pure ICT training to help journalists use the tool to research and reports. And what we are working now is to, again, train journalists how to use information better to report on maternal mortality related issues. So that is essentially what Penplusbytes does. So like the name, Penplusbytes, the bytes is always about computers. So we are mainly in the business of using ICT to train journalists in various aspects.
Mr. Fred, when you first came into our office and you were requesting for the airtime to talk about maternal mortality, I was a little bit taken aback because when I read Penplusbytes, my mind also sent me to how will I say ICT, for the world of ICT. So how are you going to use your organization to train journalists to talk about what motivated you to look at the maternal mortality aspect?
Okay. Now we are in a computer world. Today you can't live without it. Whatever you do, use ICT. So again, the whole idea is to use ICT to report better. You want to use ICT to research so you can write better on stories. You want to use ICT to know how to analyze data that you can use. You typically go for an event and you are loaded with a lot of figures that you have to come and report, and sometimes you don't know how to go about it. So you report on the raw figures. Now we think you should be able to better use those figures, better interpret them in reporting. Now, as I said, we cover various aspects in training journalism, equipping them with ICT. And now we are shifting our focus to maternal mortality because, fortunately, all of us are born of a woman. We all have mothers. Either she's alive or not, you were once born through a woman. Sadly, though, and we can tell from Mother's Day celebration how much affection we show for our mothers. Sadly, not every mother who goes into labor comes out alive, which shouldn't be the case in a 21st century computer age. So we are saying that, look, this is a huge challenge that must be addressed. How do we do it from where we sit as Penplusbytes? If we get journalists to report effectively and often on maternal mortality, we think we can get some positive response. If you get more people who speak and discuss the issue on radio, for instance, on your network, our mothers, our sisters will get informed. Even our daughters will get informed when they grow up. They know what to do so that when they go into labor, they will survive, so that the child will survive. So that is the motivation. And key to it is the fact that as a people of the world, we have set a target that by 2015, we should achieve some target in relation to maternal mortality. We are not getting there. And worst of all, in our own region, we are not doing well. So we need to accelerate so we can achieve a lot more. So that is the motivation for embarking on this project, and the motivation for coming into your lovely studio.
Well, thank you very much.
To go a little bit back, as I said, we do training. We train journalists using ICT in various aspects. Now, akin to what we are doing is the fact that we are starting another training program for journalists in the area of maternal mortality, starting from tomorrow. We've selected a number of journalists across the region to train them so that they will be able to appreciate and write better on maternal mortality. Now, if we have a lot of journalists writing very often on this topic, we will have enough information on how we are doing well or how badly we are faring. As it is now, the data we cannot fully rely on because of issues of information flow. We have an idea that we've made some gains, but we've not done very well. And Volta region, among all the regions, is also not doing well. So that is the reason why we need to put a lot of interest of our journalists in this area for them to write more, so we can have a lot more figures out, we can have a lot more information out there to be able to work with. It's a serious issue, as you said. The outgoing minister is passionate about it, and we all should be passionate because we're talking about our mothers, our sisters, the most lovely kind of human beings you can find. So that is the focus, and we're hoping that with the training that we're going to do for this journalist, when they are done, the works we'll be doing will give us a lot more information. So come next year, when we are talking, we can talk with more emphasis and with much more accurate information on the real situation.
But Mr. Fred, still on this maternal mortality issue, I believe too well that it is very dear to our mothers out there, because they suffer the most when it comes to this kind of issues in our health. But then, looking at Volta, throughout your training, what are some of the things you've identified are some of the causes of this maternal mortality?
Well, okay, the training itself for journalists is starting tomorrow. But what we found out, one, is that there's a general inadequate information in the system. A lot of people are not our mothers and our fathers, because it's not only the responsibility of the woman, are not aware about what they need to do when they get pregnant. The frequency, the fact that they must go to the hospital all the time, they must report anything that they are not too sure of and seek medical attention. Not too many people are aware. In fact, there are those who believe that it's better to give birth in the house or at home than the hospital. All of that must change. And these are the reasons why we are getting high rates of mortality during birth, because they don't go through any proper medical system, and then when the complication arises, it's already too late by the time they get to the hospital. So these are some of the factors, and that's why we think it's at the basis of it is information flow. And that's why we need our journalists like your good self to be telling a lot more stories about maternal mortality. Let's reduce a bit on the politics and then talk about health as well, so that we all get educated and then we'll take the best of decisions. So again, that is what we are driving at. This basically at the desktop is information, and because we are not well informed, we don't take the right decisions to make sure that when our mothers or our sisters get pregnant, they seek medical attention throughout.
Well, listeners, we've been speaking to Mr. Fred Avornyo from Penplusbytes organization. They are here to train journalists with regards the issue on maternal mortality. You would recall that the outgoing minister is very passionate about this particular issue, and we are trying very hard as a country to meet the MDG goal 4 and 5. So he has been enlightening us on the issue. But then quickly, I'll move to my friend Eddie Ameh. He is an Ewe, so I believe he will help us understand it more in our local language. Fred, miabenya sala nanye fly trauma now radio don't go develop heritage 107.3 by Avalaji. Mi no focho. Miabe no miajila obe kukucho vijijime. Fly afeto vi Fred Avornyo kule Eddie Ameh ocho Penplus organization lo do pede sike le agbagba jebe yo to do the journalist o menu so strong jina miabe dole yan alo miajila obe kukucho vijiji meta o le miagbole fibe oponu ami echo enya yan tu fly Eddie Ameh le bonye le fibe Mr. Fred Avornyo Eddie we de ko ba miabe organization alo miabe do pe ya ene nkola je abe computer do pe ga ke abeleke Mr. Fred Avornyo bra abe million kude mile mon dibe yoko to do what to do na nyajo jongo la be waja ba a spread alo akaka nya de nyaji la be bididi be kuku nuka na be mi tomo ya wu mi tomo ya mi am ko mi
ko ji de alo yi Ghana Health Service o now any paper gbogbo do number allergies leke awo ana nyasela wa nya be de ele knowledge esenya de lefi leke asa computer awo research nwe de akpobe de enya igbomele de nyatefe alo ahachwe alo leke a compare domain Volta be figure so to domain Ashanti a compare be de Volta mi la gbagbaja alo mi le megbe yi alo leke nukawe hia alo nukawe me hia a don kujibe ncho mi president play mi minister obetebe you no dele you pay for 10%. You are called a gakemi obeti to chips compound. Chips compound, koji VVV viole, a copper ome. Consider you by the demi sebe okbo 328 million times 328,000 CDs. Abe nyajo jongo ladi biado kyo sebe de a garden oko to chips compound onya tepa amachile chips compound where lekemia mia no de no yi no fofu ho yi kojide nuka nyakawe to awo ya nye hehe midibe mina nyajojon rola so that mi have Virginia wa ayinwe le mi have Volta.
Mr. Fred Avornyo kola di kola nka makaraji abaleke miano bi Eddie Ameh gbole hokora ma ga kwentaro chegbo abaleke mi de wona ya to ma makaraji bilibo be mia no be vigidi gbole kuku le vidi ngoni wa enyo sikele ejijina mi abedo be bilibo eta mi jawaba to gbo miamenye NGO alo do president of the health sector ga kenu ya mi de to ma carriage be enye nure sike le jijina mi blibo mi carriage be mi awunu mi akpo on jejele me magbele puede ko be nu kana tagbolo na mi cho bididi mi ano be bididi klo be afoku popo le bidinya o me nu ka osusu be na wona ya to be na
ba nye joneba chikara na mo alo na mi adada ofufu a when the share jinabe ya yi koju robo mi apama kwe na hela apama be o apama kwe no na cash na nya de anwa bazungu afina ejiji aba fuda be ya yi kojiko ala too late o alo bado nano ata ajore de viaji yo lo fudo ma hela apama manyanyanko ko kasi doing tamanada na bia yi jifo ko le via akuho tan hiamba dawo alo no vi alo so yo fofuko na ikoji to blog na be kwa wa hiabo va koji yo ba antenatal no wa de ka fi tamanada amwekum wona mo shigada owe nwa jonala ojema tae miwa ehia miagwe na mashama na anya bede na jagba agba health insurance li na hokada magana na for hagala kojio ta amashama na nya na nama ko no jo enyanya dawo strong meke na ma prove ko mbo na ma na ikoji na no koji dem ka fi eya na do na mo we na mo ina fokio no jojo na miaji ko ale edi brena le mi Volta ntoma story manyo crop aba kopon le mi ahia fine me official fi na koji ko ado mo amanyo but tomota na situation va o se va se signer fi na bi a Russia yi koji aka enya gleho ta bi ku na mi adadawo la via mi afofo ha la be viento la bela yo forma na ncho global here amashamo one ta ahia pa ba nya fofo alo strong chuo wo bon o boba na yo strong yonwa fofuko oje kojimo no koja them na nya magajo man yo kraba the 21st century ko am mia dada mia novina fofuko matan agivio miento natural o de via amma kokos noima tanaga John Fia Koka adafu eta kumba mianto mianovi journalist one nunu nya glom na mona sogomba mi baba mi o computer we mi ona aka fifia na bia o researcher na computer information journal ko na poga eta mi afia journalist mi na ma ko na information adele ko no yiji ko information adu amadava keke amo avakobo chike la shinye I want na do ala ever on any radio station ina ma van and mako you can information hoga nya ayi internet aji laba yanaga ola unya gale wata internet aji wa our research ko go wa nya gro me ala pai ta mi na ga mama na yi abi glunya laba na mo we na mo na nya gro amala mala manya ta fo amara venu a chika mala ma be o treatment am ko vazu ngubua ka avada funami tayeta kun miafia nyano vi journalist wanya le ko tanza computer internet plotomo whatsapp mo kata atanko a research and apo information le maternal health matanglo story am shama na second yeta kun ya pa ima
kopere ya tioni mi tamile he chenya yebedi mi anya jojo no lade politics actually vasu akba cho in this 6 bando as 6 politics on kukukude actually he me so that na our politics actually na nyaleke akọ enyakede ko deme na amegade politician ede na wasi na wanyabede oh e kofe kemede cho kofe kemeba Hohoe government hospital there 40 kilometers e mo menu time bere mi on mi wo mo alo the chiefs compound vida kwawo adi next that efmiko ya no maga ku no yivijife ya ku
yo mekanajibe enya afonwede Mr. Fred ke fifla mi be journalist o mi dibe wo tutudoji nuana journalist the start ko na taba mi agbo alo nuka mawatu gadale ejebe woni kafi wa soro nu le mi agbo cho enya atogbo nwa
okay eya wo mi la fia nya chia ho ale mi confirmation mi publish information am we oju bi Australia o apply ko mi chia ho mi gomo jege echo ka ba nya gbanto ogem na mi wo fo ya wona bu gala ba mi jibe am gade na strong cho ya ogem la ta yekunya ya wo mi la gbangbo
edi abeleke mi gbele wo kwa mi le tutudo jinu so soro wona nyajojo ngolo la ogbe amagede wa no bubulo susu me be fifla enya enya musikele jojo mi le po we sia we nyajo jo ngolo la ole nu gboro nuka susu be mi awe tutudo ji ya na ga ve ko wu e ma we le ko bi necessary
okay tamile mo po ben tutudo echo kudagbe player dagbe milewo tamile mo po be cho fidagbe mi anya jojo ngolo lawe wa fonu cho mi ano yo ye vijife ekuo alo ple de vio kuo wa fonu chun sa mi ase leke figure alo number lao o leda ne edoma hi Hohoe no to me nyonu yuwe ye ne edoma hi 10% alo ewoda la faji nyano ewoda la faji yewe ekuo alo no kemi na mo hwe susude ne faji mo no nyabede enyala enubli boy it's a very very serious issue jebe amesiame tamile mokpobe ade chofida gben wana amofe susu afa enyakeji zan ne mi apoleke mi aweda.
Mr. Fred, go to Mille Mokove, to me about to doji no sosro yama, and ya takakala, alo journalist, what ponuna do come if you go to. But Nadena, Nuna do chum, Mian,
le 1 year live wagule, labede, elevie, doing here, and never viandalo, a calendar blogger, America, Mogomasego, hello, interest like Momonogo, actually in the blue young. I can't feel a lake and I report here, the bloke, okay. Oh, hello, doing enough information, bo. Every year, hello for the Shama, I'm 1,000. You kuna cho doima. Okay, all confirmation man. Like in the blogging, now most of blog. Maybe nyare ko nya deko blomolo. I can ya blomola. I cho a kanya ha. More me a journalist who can not break it. I let me bring a politics of Vivian Bongwa. Nemi ha bloma wa Vivian Bongwa do three. What I would do them. It a kum ya a kum na journalist too.
Journalist, I belike mi leg bluff fra, a mark blade, mark blebe, leke mi call work, I'm a chachan nyala, ella bena, abemile fia, later mammy bulove, your publisher. Medomi ogbo, that came ya chemini nyakaka, a dollar, leke mi wo me, I'm a chachala, name yano monopobe, name you were body, monopore lebe, Miaga Kwam so over.
I'm a banto or miller. Journalist with the original Miesubo. Ta Banto, I'm a weird talk. Miko Jogome. Name me for Miga Boga. I'm a carrier, not uncle, Popola. Tawa, the GD. I will cry over the gas on my gat.
I like to blame journalists so super. Then my blow, Hohoe the day, radio station, I'm a ton elephant. Aha, time. Mikoleke Ekela Ida. Name ya wofoko. Next batch.
Mr. Fred, Cafe me as you get a New York dog, me one as a super around me bun as a super door pedally, then I'm a banner, door Cafe, then a foyer low corner one I out then to me. Me a body, me and Tommy Abe, Tadojinu, low, me and them a banner, me a look at low, Macbeth the Rechu Teperel Babana.
Okay, I will me Star Ghana. Stagananya, the operator, a dubu, Europe, oh, for food, Wodo, Roko, Gavi, Vidamoko, Apere, a dovu, a kg, Ghana. Tae, Penplusbytes, Mikomia, Mianto, Bubamia Wodoya. Yemi, the Stagana, Tobo, all Lorigi, Ropa Pamia, Miao, play. Ya woman fifia ta stagana to we pepem mian ni do won
yes stagana to o gere mi agile pepere mi on ke mi abe du doctor pesi ke kona mi abe la mesenya ogbodi pepere de won le o le mi anacho mi aba afoya de mi na
maya directly aka ba ya o gemila mi amado chagacho o bodo mo ava kun journalist to tayenya preparing program lab cho ministry agbo
Mr. Eddie ke me carriage be fifla bi le nu kwa I'm a journalist alo nyaka kala mi o kata mi chia o le claro be waje wona go me ke fika wona ya leji no gbele
oh aijile eho echo bete ple kuda gbete wano eho Nafiano Joe
okay. You I would like you to give us your final remarks about the exercise and the training that is going to take place at home, what is your expectation?
Okay. I think first we are happy you are seeing this on radio, and we know the listeners are listening in. So they will expect to see better reportage from the media after the training, so that if it's not happening, they can hold you responsible. But largely, I just want to encourage you and all other journalists. I very much belong to the fraternity. I'm just on a small break, so I very much see myself as one of you. Let us expand our reportage. Let us cover other very, very important areas like the maternal mortality issue. It is very, very important because women play a very important role. And typically, and it is true, if your mother is educated, it's granted that almost all the children will be educated. But you can't guarantee that when your father is educated. So if you lose one woman, you've lost a lot. So it's very, very important that this issue of maternal mortality is held close to our chest. Let us discuss it on our programs. Let us do a lot of stories. Let us do features. We can do features on what is happening within this locality, and your sister station in Accra will also broadcast it there, so that everybody gets to know. I mean, the issue about the figures, for instance, what will train the journalists? For instance, if they say that government has been able to accrue 300,000 plus, the journalist first bit will be to go and search how much does it cost to put up one chip compound. So if you know, then you can know that, okay, this amount of money that they've gotten can build X amount of chip compound. And in fact, if you are reporting and said, oh, government has been able to save 300 and something thousand, which can build X amount of chip compound, that story will be more interesting to the listener than if you just mention the 300,000 Ghana cedis. Because 300,000 Ghana cedis depends on who has 300,000 Ghana cedis in certain cases cannot even do anything close to a hospital. But if you tell the listener that 300,000 Ghana cedis can give us X amount of chip compounds, that is a better way of reporting that same story. I'm sure if you listen, almost all the media houses that I have listened to, we just reported the figure. We didn't relate it to the chip compound. Meanwhile, we all know that the purpose of that deduction is for the chip compound. So we are hoping that after this training, we will see our reporting more of that line so that people can easily appreciate and then they will enjoy our story. So we can go on some political breaks more.
Thank you very much. Eddie, journalist alone ka do wala ka kan ho ko
Beleke Avornyo chichi boy dunya he nyawo over subo akpa mi blo mi ave la mesenya o chevide especially ekele mi ano kule mi avio mi asron ogu ta adam dodo kemi koma kona ne no fesusu chede na yifimio ne amononya no yewa wo kule no yoma wo especially no fofu le etonmi okola hopefully me achieve MDG goal number 5 la ko mi atan ai paradiso la me.
Well, listeners, we'll be speaking to Mr. Fred Avornyo and Eddie Ameh, all from Penplusbytes organization. They are in Volta region to give training to journalists with regards how to give good reportage on maternal mortality in the region. I believe too well that it now behoves on us, the media, to be able to carry the message across to the length and breadth of the region, so that what they want to get out of this training will come to fruition. I want to use this opportunity